Welcome to the Wellnest Mamas podcast. We are committed to leading a sustainable lifestyle and making community connections. In a world where stress and chaos seem to be the norm, finding balance and fostering a sense of true well-being is essential.
Whether you are just beginning your holistic wellness journey or are already deeply dedicated to the practice, this podcast is for you. Join the Wellnest Mamas as we uncover the secrets to holistic wellness and discover the power of building a healthy community that supports and uplifts one another.
Sit back, relax, and get ready to embark on a transformative journey to leading a sustainably healthy lifestyle. We're glad you're here. Welcome back to the Wellnest Mamas podcast. I'm Caitlin.
And I'm Steph.
And today we're here with Dr. Marissa Acevedo.
Hi.
Hi.
So, doctor, tell me, what kind of doctor are you?
So I'm a doctor of chiropractic. I am actually a sports medicine chiropractor.
Oh, wow.
What's your favorite sport?
Softball. I grew up playing softball, so
cool.
It's kind of a tie between softball and cheer.
Okay.
But I know cheer is controversial, but I think it's a sport.
It is a sport.
Yeah,
totally.
Very athletic. Very athletic.
Yeah.
That's my favorite part.
It's so cool. Are you from NWA or did you play softball
I'm not.
elsewhere?
So I'm actually from Jasper, Missouri, which is right around the Joplin area.
Awesome.
People just usually assume Jasper, Arkansas, so it's Missouri. But yeah, just an hour or so up the road, not far.
And how did you get into chiropractic?
Yeah, so I actually have my undergrad in kinesiology. So it's a very broad undergrad, and we were able to do several different internships and shadow a couple different providers. And I kind of switched around to athletic training, and I was like, maybe PT, and I knew I wanted in like the healthcare field, but just wasn't sure like what I wanted to like specialize in. And then I had shadowed a chiropractor in Joplin, and I didn't even know anything about chiropractic, never been, and he just kind of blew my mind. So I went there and I loved it, and I loved everything about it, and I was like, I signed up like the next semester to go to Cleveland and Kansas City.
Oh, wow.
Yeah, I was like, I finished at Missouri Southern, and I was ready.
That was a huge impact.
Mm-hmm. My husband was a trooper when I went along.
Did he come with you?
He did, yeah.
Wow.
Mm-hmm.
So you've never done chiropractic, or you'd not done it as a child, so it was something that you watched somebody do, and what was it that was like so unique? Is it because they were just more well-rounded?
Yeah, so it was a very like a broad career. So you could kind of cater it to however you wanted to practice. And the chiropractor that I had shadowed, he's seen all kinds of individuals, from babies to elders. And so I thought that was really neat. So it wasn't just like a specific population. We could, treat a wide variety of patients.
Do you treat a lot of young people since you do sports medicine? Or?
Yeah, we do, and we work a lot with local high schools. So we are the official chiropractors for the university, but also Fayetteville High School, Harbor, and Farmington.
Cool.
So we get a lot of their athletes that come in the office, and some of those are, junior high or even younger.
Wow.
I went to my son's football parent meeting last night, and the sports medicine lady came up and she told us all about the things that they do. They are getting like cryogenics and maybe not cryo or whatever, but like they do all kinds of things. Is there any like weird things that you would do, like cryo, or there was another one, laser treatments? Is that?
Yeah, so I think that's what sets like our chiropractic group apart from others, because we offer so many treatments. It's kind of a long list, but we do have laser. We have shockwave therapy, which is my favorite. It's one of our newest therapies we have, but it's really cool. So it's kind of like lithotripsy for breaking up kidney stones, but on a lower scale. So we're going in for these chronic like tendinitis, tennis elbow, golfer's elbow, and we're able to get like these chronic injuries, get blood flow to them, so that way it can provide that healing process and kind of restart that. So that's one of my favorite ones.
The
that
sound
we offer.
waves, like
it's
the
a little,
blood.
Yeah, it's a little uncomfortable during the process, but it's very effective. We've seen a lot of great results with that.
That's really cool.
Yeah, and we also have like our traction tables, so decompression, cervical and lumbar, and some stem units. Basically, like anything that you would see in a training room, we have in our office as well.
So is there anything that you would recommend for preventative type treatment? So I'm imagining if you're an athlete, you're relatively healthy until you're not. Is there anything you can do to keep yourself nimble.
Yeah, absolutely. I think, besides chiropractic care, like coming in for regular adjustments, stretching is huge because a lot of younger individuals, they tend to take advantage and, I don't need to stretch. And then they go out there and they lift heavy weights for, their age, and they get injured or, they feel it 10 years down the road. So stretching's a huge component for me. And even in the office, like, I'll give you some homework. So you'll go home with some stretches and you come back and let me know how, like, you did with those. And then we kind of progress from there and maybe work into some strengthening exercises, but stretching's a huge one for me.
Awesome. So I have seen a chiropractor for a long time. I've seen a variety of chiropractors. I've been to the bone crackers. I've been to the very gentle adjustments. If I were coming into your office as a new patient, like, what would that look like? What kind of philosophy do you have when you're approaching someone, that might not have any experience with chiropractic care?
So first off, and like for most, we come into the office and I do a thorough exam. So I do, the main component is palpating. So feeling around the spine, trying to feel what specific joints are involved and not just, random areas, but finding that specific area a problem, even if it's not the area of pain. And I do more of a manual approach. We do have an instrument, because there is a few individuals and, young kids that we just don't do the manual, like pushing and popping with. But majority of the time when we work in the training rooms, it is manual. So a lot of times when we work at the university, we have just a single table in our hands. So you got to make it work.
Your hands are your most powerful.
Exactly. At all. I think that people, my mother-in-law she's going to listen to this and be like, why are you talking about me? Because you're a great example. So she had never done chiropractic care, and now she's like in love and like, I can't miss an adjustment. It's so good.
Good.
So, but I know it can be really intimidating. So it's nice to hear that it's really not. Like, you go in and just, you can feel good.
Yeah, and there's some individuals that I don't even do the manual adjustment the first visit. Yeah. Sometimes we'll start with an arthrostim, which is just a very simple way of getting some motion back into those joints. Just kind of work our way up to the manual until they feel comfortable.
Excellent.
So you work a lot with joints?
Yes.
So, I mean, I know a lot of chiropractors, it's like spine is the priority, but there's other joints. So do you get a lot of knees, ankles, elbows? Is that shoulders? I mean, there's more than just the spine? I mean, or is that the root of it?
I would say about, probably 60-70% of patients come in with spine problems, but there are a ton. Even just when we go to the high schools and the university, there's shoulders, ankles, every joint that you can think of. There's people that have came in for that.
And do you what would be the difference between a chiropractic approach versus like a PT approach? Is there, can you explain that?
Yeah, because I know a lot of people kind of get those confused. And we actually have like PT on the upstairs of our building, and then we are actually on the bottom for chiropractic.
Oh, cool.
So I would say the biggest part is the manipulation. So, there are some PTs that do kind of mobility with the joints, but they don't do the chiropractic adjustment. And so we do some like therapies similar to what PT would do, like stem, even some PTs do laser decompression. But the biggest difference is that chiropractic adjustment. So that manual
putting
force
things
into
where they go.
Yeah, mobilizing that joint, whether it be, the shoulder or the spine.
Very cool. So I'm just trying to imagine, like, do you like just see how the bones work together and then like I know, like that's what it like.
Yeah, that was a huge component of like the whole first year of school. You don't even do the adjustment. You just palpate. You see how the bones are moving. You see how the shoulders, the ankles, everything moves first and moves properly, because some joints are hypermobile, and that's not something we want to put a whole lot of force into. But just making sure things are moving properly.
Do you watch people's gait, like the way they walk?
Yeah, I do posture assessments, especially in the younger generation, because there's a lot of the tech snack.
I know, I've got it. Don't look at me. I had Miss Charlie came up to me and she gave me a back massage, and I was like, oh yeah, that's right. I should have my shoulders where they're more proper.
Yeah, I bet I catch myself too sometimes.
I know.
hard.
Yeah.
I've actually never gone to see a chiropractor because the same thing like your mother-in-law said. My fear is that I will have to go weekly.
Love it.
Yeah.
Yeah,
Did you find that? It's like, you're like, wait a minute, no, I can't possibly commit to something else.
That's understandable. we have some patients that come in for like routine, every 2 or 3 months come in for an adjustment, and some just come in when they feel like they need it. Like before that pain starts, they can usually tell, oh, this is getting stiff, and they'll come in for an adjustment and get it taken care of before it's painful.
As needed.
That's cool. That's how my husband's used it. He's gone a couple of times, but it's mostly been when a kid got something out of whack or something.
Yeah, it's like like you're gonna feel it the next day.
Like he was wrestling too hard with it. So it sounds like you guys are really connected to the community, as long like
Yeah.
you're working with all the athletes in the area. But what about the rest of the community? Are you guys have a presence there, or do you have like kind of a vision of how you'd like to be part of the NWA community?
Yeah, so we are actually a MANA clinic. So we work with, there's over 100 providers in MANA. So we work a lot with, other PTs, primary care doctors, the neurosurgeons. And we're just recently relocated to Johnson, so we're getting to know the Johnson community a little bit better.
You've been to Hale Fellow Wellness.
Yes.
Oh.
It's so good.
It is
Everybody
so good.
go there.
Yeah.
Johnson.
Yes.
It is so good. Yeah. It's unique too. Like
Yes.
different
I
type
love
of
the
food.
sea foam.
Yeah. Colors in there. Sorry.
No, you're fine.
Johnson's a great little community.
Yeah, and I think that helps us too, just to get our name known is like through MANA, because we're able to easily communicate with other providers and kind of work together versus like, oh, have the patient go get these records and talk to me. So
I really
we're
like
able
that
to communicate
it's
easy.
integrated into the whole system rather than being on the outskirts of like, oh, you can't go see that one.
Yes.
They're alternative.
Yeah,
I love that
exactly.
you're included and
Western medicine.
valued. Yes, as a part of the team. That's really cool.
Yeah, it's definitely been a huge change from 50, 60 years ago. Chiropractors and MDs used to kind of butt heads, but now I think like we're able to actually communicate and explain what we do and how safe it is versus just seeing what's on the internet. So it's nice to be able to have that.
So do you see young babies too? Do you ever see pregnant mamas? I know I get a lot of questions
Yes.
about, do you know a Webster certified? Is that something that you're familiar with?
So I'm not personally Webster certified. We do have a couple of doctors that do Webster because we have 6 doctors in our clinic. So it's a pretty big clinic, and we're right down the road from Willow Creek. So we have seen a lot of pregnant patients, especially since moving to the new location.
What is Webster? That's the flip where they can help flip the baby externally?
Yes.
Yeah.
So if a baby's
It's
breech.
just the methodology, right?
Yeah, so we're not like physically like moving the baby, but we're adjusting the pelvis and doing some ligament work just to encourage the baby to, hey, you have more room in here
It's
now.
not
You
as
can.
tight to wear. Okay.
Yeah, exactly.
That's neat.
Yeah, I got adjusted all the time when I was pregnant.
You're like, this is going to be good.
Yeah, it was a lifesaver, and then I adjusted my baby as soon as I could.
So it's something you would recommend for a normal pregnancy?
Yes,
just to
absolutely. Because
keep
there's
your
normal
hips
like
and-
aches and pains with stiffness and especially because they're that the hormone relaxin in pregnancy, so there's not a whole lot of stability around the pelvis.
No, I definitely found
Everything's
that out.
stretching.
I remember I did the belly wrap, then I throw it over my shoulders, try to like heave ho with it.
Like everything is sinking and loose.
Yes, yes.
You really
You
can't
just,
posture.
yeah.
You can't.
and does it come back? I mean, I feel like I've been postpartum for like 8 years now.
If you went to the chiropractor,
I know, maybe we can put things back where they
There's
go.
definitely a stability component, the pelvic floor that comes into play after
yes,
that.
Yes. Oh, cool. So, how did you hear about us? Was it just through the functional medicine group, or okay?
Yeah, exactly. So the group on there, and then I researched you guys a little bit, and I was like, oh my goodness, this is so cool. And I haven't checked out your shop yet, but I really
That's okay.
want to.
That's okay. It's new again.
Yeah.
So that's okay.
Well, we have lots of mamas that are coming. I know planning this Saturday we have the birth meetup, and
we do that every month too. So
Okay.
We're always looking for, professionals that can offer any insight to expecting families,
Yeah.
It's just a good place you can come and ask questions and be like, okay, what are you doing? What are you doing?
And it's a great place to connect with other people who serve the birth community too, because we get so many pregnant mothers, but we also get doulas and midwives and nurses, and so having that person to say, oh, I know someone you can go to. I know what's going on. It's really
I definitely
nice.
want to check that out.
Yeah.
My little one is very social.
Yes.
Oh, great.
She loves making friends.
There's always like at least one baby there.
Yes.
Maybe
Oh, yes.
closer to
We're super
2 or
baby
3.
friendly. But yeah, that's every first Saturday of the month. Just so
Okay.
you're, keep it on your calendar. If you're busy one Saturday, definitely come the next. Always at noon. And so, yeah.
Okay, well, really cool.
Great.
Cool.
Yeah.
Is there anything else you want to share with our listeners? Is there anything that we could do at home, like a helpful tip to a stretch or something?
Definitely movement.
Okay.
And there's not a specific, like, I'm not endorsing, like, just yoga, just Pilates, like, whatever you feel comfortable with, try to do that majority of the days of the week. So
Okay.
even if it's just, like, walking, like, get some kind of movement every day. And I, if it's just like, oh, I want to go walk the mall, be one of those mall walkers. Like, that's
That is
perfectly
nice.
fine. If you're
Actually.
moving those joints, you're moving the spine.
Okay.
Motion's lotion for sure.
Ooh, motion is lotion.
There's
Yeah.
Remember that forever.
Thank you so much.
Yeah, of course.
It was so nice meeting you.
Thank you guys for having me.
Yeah,
This was fun.
it was great.
Until next time.
Bye, everyone.